We know that there are challenges happening in towns and cities across the United States as we seek to introduce cycling as a fundamental component of our multimodal transportation system. We're trying to think about, how do we actually build the infrastructure, the biking systems, certainly the curb cuts and everything that comes with as a part of that, as a part of what we're doing here in America, so that it becomes as ubiquitous as you see it in other countries, and certainly as I saw it in the Netherlands. But in cities across the United States, we're seeing this clash of cultures, right? And so questions are coming up. How is equity being defined? And if you do a quick search of transportation equity, you'll see transportation equity meaning, how do cyclists get more resources, and how does bike infrastructure get more resources as compared to automobile infrastructure? And that's called transportation equity. But there are other definitions and considerations and nuances in terms of transportation equity, in terms of, when you're laying out infrastructure, who's getting the infrastructure first? Here in DC, when they started laying out bike lanes, it was in the upper income neighborhoods that you started to see the infrastructure first. Who gets access and when? These are all questions. Who determines the priorities? Communities who have been biking and walking a very long time, by the way, who have always had a low carbon footprint by necessity, because they don't own a car, have been, biking and walking. And so, to the extent that, folks who are very eager about transportation infrastructure and cycling come around and say, we want to make sure that you have some protected lanes, and everybody's like, can you give me a job? Who determines those priorities? Who is engaged? Why and on what terms? What is the desired outcome and for whom? When you're envisioning your ultimate objective, your ultimate goal, what is the population you see in your mind's eye? Does it include everyone? And so with that, we know the statistics, and this is from the National Household Travel Survey. It's showing that, as you go up the income scale, the share of adults who use the bicycle for recreational trips is higher at the higher income levels. And then the share of adults who use transportation by bike or who use bicycles for transportation is very high at the lowest income levels, showing you the necessity of these low-income populations, disproportionately people of color, for using bicycling and walking as their primary method of transportation. So you've got natural allies, right? They should be natural allies. These are natural allies. So what's the problem? Well, so here are some interesting statistics. Cycling is concentrated in central cities, especially near universities and in gentrified neighborhoods. So harken back to what I just said about how bicycling was rolled out here, infrastructure was rolled out here in the district. Similarly, in places across the country. In the United States, 24% of all bicycle trips are made by women. Isn't this an interesting disparity? And 76% are made by men. Almost all of the growth in cycling in the US has been among men between the ages of 25 to 64. While cycling rates have remained steady among women and have fallen sharply but for children. People are afraid to let their children bike. However, again, speaking to necessity, children from low-income and minority households, particularly African Americans and Hispanics, are more likely to bike or walk to school than whites or higher-income students. So again, you see that necessity of using walking and biking as a primary mode of transport for low-income, primarily minority communities. Yet, there's some bright horizons in that bicycling is becoming more diverse, with rates rising fastest among African Americans, Latinos, and Asian Americans. These three groups account for a growing share of all bike trips. So, we have a diverse array of challenges that face us when it comes to biking in America. So what Andy was talking about earlier is very important. And I don't know how many of you have been following the controversy around the environmental movement in the United States and the lack of diversity there. Nobody. With that, I was asked to talk about targeted universalism. Now, I want to talk about targeted universalism from two perspectives. One is from policy design, and another one is from practice, advocacy practice. Traditionally, when you're talking about designing public policies, you have the concept of universal policies, policies that actually apply to everybody across the board regardless. And your universal might be a city, your universal might be a nation. It depends on what your jurisdiction is and how you're actually defining universal. And that third option is called targeted universalism. Universal policies, policies that are universal in scope, but have targeted levers within them that are actually distinctly focused on addressing certain populations. And so when you're talking about disparities, whether that be disparities in infrastructure, whether that be disparities in terms of health, whether that be disparities in terms of funding, that you're actually looking at the lay of the land and you're coming up with a universal policy. So we're talking to bicyclists here. Universal policy might be a citywide transportation infrastructure that includes cycling. But the targeted levers is where is the infrastructure absent? Okay, wherever the infrastructure is absent, we're going to design a portion of the policy that actually addresses those areas. In terms of creating a targeted universalism policy, you have to actually define your universal goal. And again, what is universal? Is it citywide? Is it statewide? Is it national? So you've got your universal goal. And then second, what you're doing is you're trying to assess where the difference is between the population and where the universal goal is. So in this case, it might be, you have the goal of bicycle infrastructure everywhere. You see that it's not everywhere. And then the third, it may be that your universal goal is infrastructure everywhere. It's not everywhere. But then you look explicitly to find exactly where the most need is, okay? So you're trying to find either the geographical areas or the population groups who need it the most. So you might find that in the lowest income areas that not only do they not have infrastructure, but they also have the most traffic fatalities, et cetera, et cetera. And so you're really mapping out where the subpopulations are that have the most need. And once you do that, then you assess the barriers to achieving the goal for each of these subgroup areas. So you're going to use tools like focus groups and needs assessments and accessibility audits to try to determine how these particular populations are experiencing their disadvantage for the purpose of determining the nature of the solution. Then you're looking at crafting targeted approaches for each group to reach the universal goal. And so in this case, it might be extra resources that are dedicated to certain areas. It might be added incentives. It might be more information for certain populations. It might be prioritizing underserved areas first, focusing on where the need is greatest first before you roll out infrastructure in other areas. And then finally, adding your targeted approaches to a universal strategy. So, rolling out your universal approach for the entire city, for example, and then embedding those targeted strategies for the populations of most need. And so, and then you want to make sure that you're measuring the overall change for the community, but also the differences between the targeted and the general population. So is that clear? Is that clear that you can actually have universal policies that have targeted levers within them that get at pockets of disadvantage, and when you actually integrate the two, you can actually close health disparities. You can actually close transportation disparities. You can actually address disparities across a number of measures that are important. So, with that, now I'm over here. The targeted universalism approach actually requires that we're not only looking at policy differently, but we're actually looking at practice differently. It requires a different mindset. So the targeted universalism approach is inclusive, but it targets the marginalized, the underserved. is conscious of issues such as race, class, and gender. It makes a connection to the social determinants, so you're not just focused on cycling, you're also focused on the economic and the cultural and the educational challenges facing certain communities. You're addressing geography of opportunity constraints, so you're looking at the geography of an area and figuring out how to get over those challenges where the most need is. You're prioritizing equity of outcomes, that in that vision you have for your outcomes, that you have equitable outcomes, and that's a priority. You are recognizing how people are differently situated, and you're in your policy making. How you engage in the policy making process is actually participatory. So, in terms of best practice for vision equity, now again, here I go. Best practice for vision equity is organizational diversity. Now, Andy has already talked about this, but being very clear about diverse hiring practices, ensuring equity of opportunity within the work environment. What do I mean by that? You look at certain organizations and you have occupational segregation. You see diversity in terms of admin and support roles, but not in terms of the professional staff or the leadership. So ensuring equity of opportunity within the work environment. Collaboration, establishing partnerships with diverse organizations and designing policy and program strategies in collaboration with diverse communities and partners. And then measurement, measuring progress in hiring practices, establishing process measures that ensure engagement with diverse stakeholders, and measuring impact of the targeted universalism policy approaches. So, I don't want to end on a sad note, but I do think that it's important that we realize, and I know that all of you do realize, how important the work you are doing is. And I understand that you all are actually focusing on Vision Zero. And so what I am challenging you to do is to think about this as VIVO, Vision Equity plus Vision Zero. And when you do that, you're prioritizing, certainly, pedestrian and cyclist safety, and of course, reducing speed. You're focusing on vulnerable groups and communities. And you're considering all of the relevant factors, health, economic, education, cultural, all of the factors that are important for getting this right. Because literally, lives depend on us getting this right.